The article demonstrates that atopic dermatitis, or also known as eczema, is one of the most common dermatological outpatient diseases. Atopic dermatitis concerns 1 to 30% of the population. The disease could also be called a psychodermatological disease, meaning that it affects the mind, because environmental stress is a significant factor that affects the skin symptoms. Skin lesions add to the discomfort of having the illness. The situation can get worse when the skin lesions are located on visible parts of the body. This is because skin lesions are seen as unattractive and receive a negative interest in society, which leads to stigmatization. The article highlights that social perception is an important thing in today's world, and because of this, skin diseases play a large role in social perception. Society can make rude and negative comments upon patients with skin diseases. They can even express their disgust or avoid dermatological patients. In results, patients feel socially rejected. Because of these factors, being ill is difficult and stressful for atopic dermatitis patients. Stress being defined as an external or internal demand which are on the borderline of human possibilities or even exceed this border. The article concludes that feelings of stigmatization can be associated with stress coping, resulting as efforts to overcome the situation. Methods. The aim of this study was to compare stress coping strategies and feelings of stigmatization in atopic dermatitis patients. The research group had 65 patients, 35 with atopic dermatitis and 30 with contact dermatitis, which is a dermatitis resulting from contacting the thing a person is allergic to. Of the outpatient allergological dermatitis department. The range of ages was 16 to 76 years old. Disease severity was evaluated using a qualitative scale. An author's questionnaire was used, a stigmatization scale was used, a coping orientations were used, and a coping with skin disease scale was used. Results. The study showed that stress coping analysis in atopic dermatitis patients illustrated two methods were used more frequently, instrumental support and emotional support. The correlation between acceptance coping strategy and feelings of stigmatization was found in atopic dermatitis patients. The higher acceptance, the lower the stigmatization. The data points out that patients suffering from dermatological diseases feel stigmatized. Studies indicate that there is an impaired quality of life in dermatological patients and result of feeling socially rejected. In short, acceptance was connected with lower stigmatization. This connects to my topic because my topic has to do with the fact that because of skin diseases and because people have atopic dermatitis, the quality of life is lowered because of social rejection and things having to do with psychological effects of atopic dermatitis.